Hello! I am 23 days post-op, 23 days, so just over 3 weeks, and now I'm allowed to wear my contacts more, I'm allowed to wear eye makeup. That's a very strange difference to me, and the swelling is going down a little bit, just a little bit of redness left. It's pink inside, and in general, it's straight. So yeah, feel a lot more better. It's a lot more comfortable. It's getting more and more scented. The more and more this becomes white, it looks better. It is very slightly turned in, but compared to what it was before, I don't care. Also, I'm looking at the middle of the phone, so sometimes I don't know really where I'm looking at. So hang on, sorry, message. So if I look up at the timer, it looks better. And then also when I look long distance, it's better. Before it'd go off, so it's amazing. It feels so much better. I've said better so many times, sorry. It feels more comfortable, it feels good, and putting makeup on is fine, wearing contacts is fine. I've only been wearing them a couple of hours some days because I didn't want to overdo it, and I'm in a humid climate and I was a bit worried, so I have generally put them in for probably like 1 or 2 hours a day. The one time I did put them in longer, I went on a tour and I probably wore them for 4 hours maybe. No, I'm not trying to leave 3, 5, 6, 7, 8. Yeah, probably about 5 and a bit hours. It was fine. I just kept eye dropping the whole time because I don't want to have it too dry. One other question. So lots of people ask me how much it costs. It's kind of confusing online, but I can only tell you what I did. So I went via the NHS, which is National Health Service in the UK, for my pre-appointments, because originally I was going to have it on NHS because my vision was starting to get a bit worse and my mental health with it was getting really bad. I just felt like I couldn't look anyone in the eye. I felt really depressed. I was newly single. I didn't want to date. I didn't want to talk to anyone. I was so embarrassed at work. Like, it was getting really over, like it was making my life hell. So I finally decided to do it. So originally I went to some NHS appointments where they'd measure them. First I had the Botox put in my eye, which tested, so they basically, Botox, this was my bad eye, so basically it goes out, and now it's very slowly going in, but fuck it, who cares, it's almost straight. But basically this eye was the bad eye, so they Botoxed it, and they tested how I would react and if I get double vision. So they Botoxed it in these muscles, just inside there. When you're awake, they put the injections in your eye, it's fine. The only weird bit is they're like, don't move, and you literally got a giant needle in your eyeball, and you're like, But it was fine. It made my eye go really straight, and that gave me confidence. Like, those few weeks, it's meant to last like 2 to 3 months or something like that, but it lasted 3 weeks on me because my squint was like, for 36 years it's been fighting to be that way, so it didn't want to stay straight for long. So I came back for my second Botox injection, and I just assumed in my mind that I would just keep doing Botox because I was too scared to do the operation. I didn't really believe it worked, to be honest, and I was just petrified about having an eye up. And I talked to the doctor, and they kept saying to me, well, the more Botox you have put in your eyeball, it's not in your eyeball, but I just want to make it clear that I'm not like putting Botox in my face, basically in your muscles of your eye. The more you do that, the longer it'll take for you to have your eye up if you do decide, because every time they have to wait for it to dissolve, and I think it's like a 3-month waiting list in order to get on the eye operation list, because they have to make sure the eyes are fully back to normal and no Botox in the muscle. So they convinced me at that point that due to COVID and everything that was happening, that it would have been better for me just to I have to sit down, sorry, I've been staying up. They convinced me that it would be better for me to just wait. It was COVID, we were spending loads of times at our house anyway, and just get on the list. So I got on the list. It was NHS, so at that point I'd had 3 appointments. So this is the only reason I'm telling you this bit, is because when I went private, I think that would have been a cost, but it was on my NHS, so it didn't cost me anything. So I had my initial appointment and on that day they measured my eyes and they gave me Botox on that day, which is amazing. I had a follow-up appointment with them to check if I wanted Botox again. And then I had another appointment to say that I was going to have the operation. They measure my eyes again. They measured with prisms how far it was, like squinting, and whether or not I get double vision. And at that point, I was told that, you know, COVID had put everything back onto hold again. The operation was going to take a while. I'd had the Botox in November, and then I went back for the extra appointments the first one I could get was February. And at that point, they were saying that the waiting list was about 3 months. So I was like, okay, that's fine. Then it got longer, and basically they told me that it would have taken until at least December. So this December that's about to come. So it would have taken basically almost a year on the waiting list. And in conjunction to that, and no judgment, I think the NHS is the best ever, and Moorfields Eye Hospital I love. But I wasn't sure who the surgeon would be on my eye, and I've obviously had tricky eyes for 36 years, so I was really, really paranoid about it. So when I started researching it, and I learned that when you're in NHS, sometimes I think, because it's a medical teaching hospital, that they sometimes let specialists, not the surgeon, but someone who is equally as good, do your eyes. So they're amazing, and they've done thousands and thousands of operations, and they're great, and I would say if you can't afford to go private, do it. But for me personally, I wanted to meet my surgeon, know who was going to do it, and like literally research them, because I'm annoying like that. I just wanted to talk to them and know that the person that was doing my particular eyes, because mine were like quite tricky and quite that way, had done like thousands and thousands of them, and that was the person that was going to do mine. So I didn't want a junior doctor, I didn't want anyone else, even if they'd done 10,000 other surgeries. I just wanted the main surgeon to do my eyes. So I researched private. So I went to Moorfields' private website, which is the first one, and they list all of their doctors, and from that you contact them all. I'm going to say a very controversial comment here. The male surgeons were all so much more expensive than the female surgeons. Just going to tell you that. So the prices do differ depending on your surgeon. You don't really get like a set price until you meet them, and then you get like a list of the cost that it could be depending on what you want. So initially, with mine, my doctor was called Miss Adams, and my surgeon's Miss Adams at Moorfields Private, and I think her name is Gillian at the beginning. I can't remember. Oh my god, I'm so bad. Jill Adams. She's surgeon Dr. Jill Adams. She was incredible. Like, she was the one that I picked out all the lists. I researched all of them. She was the one that specialized not only in children's but also in complicated cases. So I contacted her. I think her surgery is 2, 3, 4 eyes or something like that. That's the email address. But she was, they came back to me straight away, and I literally annoyed the shit out of them on email and basically said, you need to do my eyes. I'm going on a job in America. I've got this window of time. Please, can you do my eyes within like a certain amount of weeks? And this poor like assistant of hers, like, I don't know who you are, I never properly met you, but I love you if you ever see this video, was at that point, I think, wait, was it April? I'd emailed mid-April, probably like the second week of April, and they said, okay, we'll hold you on the 11th of May. So it was actually a month. They'd held me 4 weeks before, but they needed to see me before, and I was on a job in Italy at the time, and I needed to quarantine and everything. So she kept the surgery, and she did a late night surgery date for me, which was amazing, which is not normal, but they held a date for me. So I did the checking of my eyes, the measurements, I think it was 2 weeks before or 1 week before. And then from then on, I then got booked in, and up until the day of the 11th, I kind of didn't believe it was going to happen. Like, I didn't really think about it. I didn't think what I was going to do. But yeah, on the 11th, it actually happened. Like, it was so quick on private, like straight in, got the appointment, got the operation, was treated really nicely. There's a video straight on one of these things somewhere telling you about what actually happens on the day. But in terms of cost, because no one ever really says about cost, so I'll tell you, in total, I think it cost me about £4,500, and that was for one eye. I don't know if it cost more for two. I don't want to say it doesn't, but I don't know, because the way it was broken down is you pay different people different amounts of money. So you pay in different installments. You don't just pay it at once also. So like you pay for the consultation on one, and then you pay for the anesthesiologist ahead of your operation. You pay him separately. That was like £500. You pay for the hospital room, that's another thing you pay. Then you pay for the surgeon after the surgery. Then you pay for little things like the medication on the day. So they give you a breakdown ballpark of what it would cost worst case scenario. And I think mine was like 5 or something like that. But in the end, I think mine came in at like, I don't want to say the exact, because I think it was like 4,300 or 4,400. But that's what it cost. And to be honest, that was really good, because I thought it was going to be like 10,000. And some of the male surgeons, I'm not trying to be sexist, but I'm being observational with this. I genuinely don't mean to be sexist. But it's bizarre. Like, they were thousands more. Like, I think I had 3 female surgeons and 4 male surgeons come back to me, and all the females were cheaper. And the males were like charging for their own service. That was the expensive bit, was like a couple of thousand more. So some of the surgeons were like, in total would have been about 6.5 grand, whereas she was, in the end, I think I want to say 4,300. I will have a look again and have a look, but it's worth it, 100,000,000%. I love it. My eyes are basically almost straight. My sister told me the best phrase ever, because I was crying the other day when I first had my eyes done, and I was like, yeah, but they're not 100% perfect. And she said, eyes are meant to be sisters, not twins. So that's good. And also, I knew that when this happened, that they were going to slightly overcorrect it. And when the blood goes, it actually will look even more scented, because it's still dark. But I know that basically what happens, because my eye was pulling so strongly that way, they overcorrected to give me a few more years, because and I can put up with this for now, but eventually, over time, they do slightly go this way. So this is basically in order for me to have longer years. And they told me this could last about 15 years, I think. Hoping more. But yeah, I'd do it again. Let me know if you have any questions. Just do it. Like, my mental health is so much happier. Like, I don't feel so much like a freak. Like, I know I'm not perfect. It's not perfectly straight, but it's just so much better than it was before. And also, it's just getting better and better. Like, the more I'm wearing my contacts, the more it's straightening. The more this goes down, the more the white comes out, the more straight they are. The more I focus, the more I'm learning to straighten them. Like, it just gets better and better and better. So do it. Sorry for the 12.5-minute video.